This is Paul Slacker's Good News Broadcast. We're speaking to Dr. Wesley Clark. He's director of the SAMHSA's Center for Substance Abuse Treatment, which stands for... What is
the SAMHSA is the Substance Abuse Mental Health Services Administration, and what we are going to talk about is Recovery Month and our 2009 National Household Survey on drug use and health.
Well, let's start with the survey first. So have we learned some things here?
Well, what we know is that the current use of substances are lower than they were in 2002, but many are unchanged or somewhat higher than they were in 2008. So for those 12 and older, the current rate of illicit drug use rose from 8% of the population 12 and older in 2008 to 8.7% in 2009. The current use of marijuana increased from 6.1% of the population in 2008 to 6.6% in 2009. So the non-medical use of prescription drugs rose from 2.5% in 2008 to 2.8% in 2009. We've also seen an increase in marijuana use, of ecstasy use, and an increase in the users of methamphetamine.
Okay, so when we call this a recovery month, what does that mean?
Well, we believe that not only do people use, but people develop problems associated with that use, and as a result, many need to get help, whether it's brief treatment or more complex specialty treatment. There's a lot of mythology about treatment. A lot of people don't believe that treatment works. In fact, we do know that it works, and people recover. The data shows clearly that they recover. So what we do in Recovery Month is allow the community to get together to celebrate the recovery, just as any disease-specific or disease process, to educate the community about the potential of recovery. We estimate that as of...
hello, doctor?
And sir, if you will, please stand by. We'll reconnect. His line has dropped. Ms. Jones, I'll open your line.
Dr. Clark?
He's gone. Something's what happened.
Oh, okay. Stand by, Mr. Slackers. We're going to get him back on the line, okay?
Okay.
Thank you for being patient. One moment.
Oh, yeah, no problem.
Yes, Paul, hang up. We'll call you back as soon as we get Dr. Clark on the line.
Ms. Jones?
Oh, yes.
We do have Dr. Clark currently on the line. He's being transferred in now.
Okay.
Let's see.
Dr. Clark, welcome back, sir.
Okay. Don't know where we were.
We were talking about treatment
okay.
And the importance of it.
Treatment works. Prevention is effective, and that the behavioral health strategies are an important part of health strategies. We have our Recovery Month website. I don't know if we got cut off there. At www.recoverymonth.gov. We want people to go to that website to learn information, to get information. People can call in for information at 1-800-662-HELP. That's 1-800-662-HELP. The reason we need to clarify a lot of the mythology is because it creates a stigma. Because people believe that, there's no problem, that anybody who has a substance use problem, then is shamed and embarrassed. And we recognize that our society's come a long way with regard to a number of conditions like cancer. People are not willing to talk about it. Tuberculosis, asthma, hypertension, sexual health, et cetera, that people should be able to talk about. Their alcohol became excessive, and they developed a problem associated with marijuana use or cocaine use or methamphetamine use or prescription drug use, et cetera. So with Recovery Month, we are celebrating that return from those problem use periods in a person's life.
Let me ask a question here. So you say we know somebody who is we think is abusive in this for themselves, right? And you have a distinguished career here in this area. What do you say to somebody? How do they help someone else?
Well, I mean, the key issue is if you know the person. One of the things that we recognize that the conspiracy of silence actually does a person more harm than good. We know that behavioral health is essential to health. Prevention works. Treatment is effective, and people recover. But if you know that I have a problem, we look at our data. 20 million people meet criteria for needing help, but perceive no need for assistance themselves. Okay, well, that means that they're in what we call internal denial, but then that's external denial. People will tolerate misuse until harm occurs, and then all of a sudden they're out of sorts. So we think that friends and family members need to convey the message that you are misusing alcohol if you're drinking excessively, you are using illicit drugs, and you should not be doing that because it adversely affects your health, your mental health, and your social health in terms of legal issues. So you owe yourself, your friends and family members, that obligation. While you can't compel people to get assistance, you can make it clear that you don't buy into the fiction that everything is fine. I've been citing a column that I read recently. A person wrote in, they were at a bar with friends. They'd chosen, quote, Sam as the designated driver, and so while they were drinking, the person looks up and Sam is drinking beer. Now, Sam goes through several beers, and when the person who had been drinking themselves pointed out that they shouldn't be drinking beer, Sam says, "What's the problem? I'm only drinking a couple of beers." So the mythology here is that beer is not alcohol, and that a designated driver only worries about the number of shots you drink. Well, in fact, if you're the designated driver, you're supposed to be drinking, soda water, Perrier, or Poland Springs, or tap water, but not beer.
Well, we way back when I was at Channel 13 Public Television, we had, I remember, a PSA, public service announcement, that showed the beer, the liquor, and the wine. What's the comparison here? 8 ounce.
The alcohol content.
Alcohol content, right? 8 ounce
alcohol
beer.
Content, right.
An ounce
12
of
ounces of beer equivalent to 1.5 ounces of hard liquor, etc. So the key issue there is the mythology that grows up around it. So the person who's brought it to the designated driver's attention was being criticized not only by the designated driver, but by the friends in the group, because all of them said, well, he's only drinking beer. And that is what we need to do. This is an ongoing issue as each generation succeeds the former, is we have to keep the message constant. We have to keep getting the message out to people. Alcohol is legal for those 21 and older. The issue is the effects of substances can be distorted by the perception that, quote, we're only having fun, and people don't deal with the consequences. They don't deal with the fact that some people are more vulnerable than others. They also don't deal with the fact that while under the influence, your decision is impaired, your judgment can be impaired, and that you can engage in rash behavior that produces undesirable outcomes.
I remember one other thing about drinking or whatever, any of these, you're just as unsafe and happens so often walking. It's not necessarily, you don't have to be driving.
You don't have to be driving.
Many people, unfortunately, the MAD organization told me that one, how many people, get killed walking drunk.
Right.
And so that's another thing. Let me, just getting back to, hands-on stuff. There's things they call intervention, right? So now I tell my buddy, you're really, you're pounding them down every day, and it's probably a little too much. But you're getting that I'm only drinking beer answer, right? So do you then how do you get more people connected to then help this person if you feel it's necessary?
Well, generally, if you believe it, you and the person has other friends in your network, you can raise that issue. You get to point out, hey, there's more than a simple beer being consumed here. This person is having problems. And you are very right. So everyone can play a role. Parents possess the power to help children avoid substance use and lead positive, productive lives. You can enlist other friends or relatives to communicate the message that, gee, you're drinking excessively, or you're using marijuana, or using these or misusing prescription drugs, and that's going to be problematic. You can call our website, our 1-800 number at 1-800-662-HELP to get information that's specific to the substances and specific to treatment. You can visit our website at www.recoverymonth.gov. That's www.recoverymonth.gov. The key issue is getting that message to the person before harm occurs. We know that 95% of the people who meet criteria for abuse and dependence of alcohol or illicit drugs perceive no need for treatment. By that, I mean unless harm occurs or until harm occurs, they continue doing what they're doing. And then once harm occurs, everybody's all upset, but it may be too late for either them or the people in their environment. So if you pick up on the fact that Sam is supposed to drink no more than 4 drinks in an evening, and he's downing a 6-pack, you get to raise that. A 6-pack of beer in 2 to 3 hours is excessive.
Okay, and I'm looking at the website, events by state, so on and so forth. Last question, Doctor. What's good news for you?
Good news for me is that you're willing to help us get that message out, and that we can get that message out, and that we are having a Recovery Month, and that we have almost 800 events by mid-September where the community is saying that recovery is important, that we want to encourage people to engage in proper public health behavior, to get help if they've developed an abuse or dependence problem, and that they should be supported for those efforts rather than be stigmatized for it. If we see seeking help as a sign of weakness, then people will not seek help. We should see seeking help as a sign of strength and as a recognition that just as you have diabetes, you have to watch your medical condition, asthma, hypertension, cancer, any other condition, that you have to watch what you do and engage the health system and take medication if it's appropriate and engage in healthy lifestyles. These are things that we want, but that is a community issue, and I really appreciate Good News Broadcast being a part of the global community, getting that message out to the people of America.
Okay, and the community's out there helping us. I see something here at Applebee's Park and this place and that place. So yeah. You got a lot of people helping you. That's great news. So thank you very much for sharing it once again, Doctor.
Not a problem.
Bye-bye.
Bye.